You hear that number at every doctor's visit, right? But what is blood pressure, really? It's not just some static number on a chart. It's this dynamic, powerful force that keeps your entire body up and running. Today, we're going to take a deep dive into the body's incredible balancing act to really understand this vital system.
Okay, so imagine this. What if your body had this super complex control panel, running 24/7 with tons of sensors and automated programs, all working on one single job, managing the exact right amount of pressure needed to get oxygen and nutrients to every single one of your cells? Well, that's pretty much exactly what your cardiovascular system is doing, every second of every day.
So before we really get into who's running that control panel, we first need to understand the force they're actually managing. For our body, it's a constant quest to find that just right pressure, not too high and definitely not too low. So, what are we actually talking about here? It's pretty simple. Blood pressure is just the physical force of your blood pushing out against your artery walls as it's zipping around your body. And we measure that force in millimeters of mercury, which is where those two numbers you always hear about come from. And those two numbers, they tell a pretty cool story. The top number, the systolic, that's the peak pressure when your heart gives a big squeeze, just like squeezing a water balloon. Then the bottom number, the diastolic, that's the lower pressure when your heart relaxes to refill. It's kind of like the baseline hum of pressure in your arteries between beats. But here's the thing, getting that balance wrong is, well, it's incredibly common. We're talking about high blood pressure or hypertension affecting a huge number of people, 1 in 3 adults. And the scariest part? So many of them have absolutely no clue.
Yeah, that's why you always hear it called the silent killer. There are usually zero symptoms, no warning signs. The damage is just happening quietly, over years and years, as all that extra force just wears down the delicate inside of your arteries.
So how does the body stop this from happening? Let's get back to our control panel metaphor and meet the automated systems that are working around the clock to keep that pressure in the Goldilocks zone.
Okay, so our body's control panel has basically 3 main departments working together. First up, you've got the neural system. Think of this as the rapid response team. It uses these tiny little sensors in your arteries called baroreceptors to make split-second changes. Then there's the endocrine system. This one's for the long game. It uses hormones to manage things like your heart rate and how much fluid you've got on board. And finally, you have autoregulation, which is just brilliant. It's like a local override switch, letting super important organs, like your brain, manage their own blood flow to protect themselves.
But out of all of these, there's one system that's like the master controller for long-term regulation. It's a bit of a mouthful, but stick with me. The renin-angiotensin-aldosterone system, or, RAAS for short.
This thing is a totally brilliant biological chain reaction. Here's how it works. When your kidneys notice that pressure is low, they send out an enzyme called renin. Renin kicks off this whole process that ends up creating a super powerful hormone called angiotensin II. Now this is the guy you need to know about. It tightens up your blood vessels and tells your body to hang on to salt and water, and boom, both of those things drive your blood pressure right back up. But even the most finely tuned control panel isn't perfect. What happens when it starts to glitch? Well, the system can basically fail in 2 totally opposite ways, and both are pretty serious. So on one side of the spectrum, you've got hypertension. That's when the pressure is just always too high, which puts a massive strain on your heart and damages your arteries. On the complete other end, you've got hypotension. That's when the pressure is too weak to get enough blood to your vital organs, which is why people get dizzy, faint, or in serious cases, go into shock. And these pressure problems aren't always about the whole body either. They can show up in specific parts of your circulatory highway. For instance, if you've got a problem with the arteries that are supposed to be getting blood out to your arms and legs, you might notice things like cool skin or pain when you're active. But if the issue is in the veins trying to get blood back to your heart, you'd feel more of an aching or see swelling. It's pretty amazing how the body gives us these different clues depending on where the problem is. All right, so when the body's control panel goes haywire, how do we fix it? This is where modern medicine steps in with a really sophisticated toolkit, all designed to help us, recalibrate those dials. And here's something important to remember. Recalibrating this system isn't about finding one single magic pill. Everyone's body is different, so the treatment is this really careful step-by-step process. Doctors will usually start with one medication, see how your body responds, and then they'll add or tweak things as they go to find that perfect balance just for you. One of the absolute workhorses in the toolkit are ACE inhibitors. So remember that RAAS cascade we talked about? Well, these drugs jump in right at step 3, inside your lungs. They block the very enzyme that creates that powerful vessel-tightening hormone, angiotensin II. And the results are pretty dramatic. Your blood vessels get to relax and widen, and your body stops holding on to so much sodium and water. Both of those things bring the pressure down. But this is also what leads to their most famous side effect. For some people, it's this annoying, persistent, dry cough.
So what happens if you're one of those people with the cough? Well, that's often when doctors will switch to RAAS. These drugs are really smart. They target the exact same system, but from a totally different angle. They don't stop angiotensin II from being made, they just block it from plugging into its receptor and actually doing its job.
I love this analogy for it. If that vessel-tightening hormone is a key, then an ACE inhibitor stops the factory from making the key. An ARB, on the other hand, just goes to the door and changes the lock, so the key doesn't fit anymore. You get the same result, just with a different strategy.
Okay, another huge class of drugs you'll hear about are calcium channel blockers. So calcium is basically the mineral that tells your muscle cells, hey, contract. By blocking calcium from getting into the muscle cells in your heart and arteries, these drugs just tell those muscles to chill out and relax. That makes the vessels widen and, you guessed it, lowers the pressure. And the pharmacist's toolkit is seriously huge. Doctors can also use things like beta blockers to slow the heart down and reduce its workload, vasodilators that directly tell blood vessels to relax, and even renin inhibitors, which go all the way back to the very beginning of that RAAS cascade and shut it down at the source.
Now, with all this complex chemistry going on, you have to be careful about interactions. And here's one that everyone should know. You should never mix grapefruit juice with certain calcium channel blockers. Seriously, grapefruit has these compounds that mess with the enzyme that breaks down the drug in your body. That means the drug can build up to really dangerous levels.
So when you step back and look at the big picture, managing blood pressure is really all about restoring balance. It's this beautiful, delicate dance between our body's incredible self-regulating systems and the amazing scientific tools we've created to give them a hand when they need it. And all this really leaves us with one final big thought. Our bodies have this amazing automated control system that's designed for survival, and science has given us these incredible tools to help fix it when it gets off track. So the final question is really for all of us. What is our role, with our lifestyle, with diet and exercise, and helping that incredible system run smoothly in the first place?